All right, let's maybe start where we have by now a number of people already. So I hope more people will join as we start. I know that there is quite a number of people from the Latin American region where it's early morning now. So I understand maybe they will join on the go. But let's start. So welcome everyone. We are hosting now our third peer technical support hub on the topic of short-term technical assistance. We have received a lot of requests, proving the demand that this topic is very important for the community of people who use drugs. And the idea would be to really demystify this process and to explain in more simple words what it is, and make sure that whenever you have a request for technical assistance, you will now know the roadmap to do this. I hope everyone can see my slides. In case there are some issues, please make sure just to let us know via chat. So the agenda of our meeting, it will run for 90 minutes, and we will start off with the opening remarks from INPUD's Executive Director, Judy Chang. We will continue then with an overview of the short-term TA, its areas and country-specific examples, done by Annabelle Massner, who is the focal point for CRG SI short-term TA from the Global Fund. We will then give the floor to Ernesto Cortes from LANPUD to share his experience of applying for short-term TA and its implementation in his region. Then Matt Southwell will give an introduction of the short-term TA providers for the community, and will speak on behalf of the three organizations, COACT, Mainline, and HRI. And finally, our colleagues from EANNASO, Leo and Yvonne, will share the regional platform experience and give an overview of the support provision and lessons learned from this process. We will have, hopefully, enough time for the Q&A session. And we hopefully also want to give you space to share your requests for your potential requests for TA. So we'll make sure to accommodate enough time for that. I will also share some ground rules for this meeting. So please make sure that you keep your microphones muted during the presentation. And if possible, or however you prefer, of course, but keep your cameras off. The meeting will be recorded. If you have any objections for it to be recorded, please send a message, and we will ensure that there is no reference to yourself if you want yourself to be removed. We would also like to take a group message after this meeting. So if you can, please switch your camera on. And if you don't want your picture taken, please keep your camera off, of course. Use please the chat box to post any questions you have regarding the presentations. It's preferable if you do it in English, but of course you can also use your own language, and we'll make sure to translate those in English and discuss. The language of the Q&A discussion will be English as well. So that's why we, due to the Zoom limitations, we cannot accommodate all this nuances with multiple translations. So if you would like to have a question, if you'd like to voice your question during Q&A, please raise your hand. Otherwise, you can also use the chat box, as I mentioned. We also made sure to have the language translation during this webinar, so we'll have Spanish and Russian. Please, in your meeting webinar controls, use the button called interpretation. and click the language that you would like to hear. If you want to hear the interpreted languages only, click mute original audio. During the Q&A, don't mute it. The translation will be provided in the main room if there is a need. But otherwise, all the presentations by the speakers today will be done in English. And now I will pass the floor to Annabelle. So Annabelle, please welcome. And if you want, yes, please, then please share your screen. Oh, I'm sorry.
I'm passing over to Judy.
Oh, I'm sorry. Excuse me. No, first is the Judy. Apologies, Judy.
It's okay. Yeah, I'll just be really, really quick anyway. I just really want to thank everybody for taking the time for joining as well, and especially for people who are presenting the Global Fund CRG, EANNASO as a regional platform, LANPUD and COACT, who all have their role to play within the short-term TA universe, shall we say. And I just want to say of all these actors, you know, we all have the same objective, that, you know, we want people who use drugs to be linked up with the right technical assistance, knowledge and skills, you know, to be able to influence global fund programming so that it better works for people who use drugs. We know up till now there haven't been that many short-term TA requests from the drug using community, and it's just, you know, a gap that we really wanted to address because this support is available. And I think, you know, it's really important that we avail ourselves and also use this opportunity. You know, I think it's a great opportunity to have us together as well. But from all the, you know, different actors that I outlined who will be speaking, I think, you know, the Global Fund will be sharing more around the mechanics of short-term TA, you know, the regional platforms of the role in supporting the application process. Of course, the short-term TA providers that Matt will be going through, like providing, you know, what specific technical assistance they can provide. And of course, last but not least, LANPUD, Ernesto being able to, you know, share his experience of a successful TA request on behalf of the community in Latin America. So yes, just finally, I want to say, you know, after the presentations, there will be the space for Q&A. So, you know, please feel free. There are no stupid questions. We know the Global Fund processes can be very complicated. And as Gaia said before, we really wanted to give an opportunity to demystify them. And then, you know, please also feel free to share examples that you've had in your head about, you know, something that you wanted TA on. And, you know, there's people, of course, on the panel who can answer your questions about it. So thank you.
Thank you, Judy. And now I'll let Annabelle go ahead with demystifying the process. Welcome, Annabelle.
Thanks a lot, Gaia. I think you have to stop sharing the screen quickly so that I can start sharing. 1 second. Can you see it?
Yes, we can.
Yep. Okay, perfect. Thanks so much for the introductions, Gaia and Judy. It's really a great opportunity to join this webinar today, and thanks so much for your initiative to invite me and share some more information, more in-depth information about the short-term technical assistance. For me particularly, it's also important to have webinars as this, because normally I'm at the receiving end.
Lost you, Annabelle. Can't hear your voice.
Can you hear me?
Yeah.
Yes.
Okay, it said that someone wanted to mute me. So, it's particularly important for me also to join these webinars and to have a conversation with you and to really better understand when we are presenting the opportunities for short-term technical assistance, what is maybe challenging to understand, and how can we improve actually sharing this information and making it more accessible to different communities. So you will receive all these slides after the meeting. And I wanted to start with this slide around who can actually apply for this type of short-term technical assistance. So we have quite a long list of who can apply, including key population networks and organizations, such as networks led by people who use or inject drugs from different countries, or also regional networks, but also networks led by youth, women, people living with HIV or affected by TB and malaria, or other more specific networks and organizations. Normally, we can process applications that come directly from the CCM, unless they have been developed together with any of these organizations I've mentioned. And important to note is as well that the organization or network doesn't necessarily have to be a legally registered entity, because we are aware that in some cases, some countries, that may be difficult. So that is not a requirement in order to submit a TA request. Who provides the technical assistance? Overall, we have a list of 26 TA providers. 13 of these are TA providers we already worked with in the previous cycle, and 13 TA providers are new, and they all have a very strong track record in human rights, gender, community responses. And what I think is particularly exciting for us, and maybe also for you, is that we have the 3 TA providers, and Matt will later speak more to their work, who have a particular focus on harm reduction, and we didn't have that in the past. So I think that's also really an opportunity for you to request technical assistance and to make use of the experts we have in the pool in order to support you. Wherever possible, we are trying to work with experts from the country or the region of assignment. And wherever possible, also with experts who actually identify as coming from the community that is requesting technical assistance, to make sure that we are working or implementing as much as a peer-to-peer character of TA as possible. On the following slide, I want to highlight some of the main areas of technical assistance that can be requested. So that's a little bit what we call our menu of TA services. So there are 3 broad areas that we have categorized the TA menu in, starting with the first one. It's support to situational analysis and needs assessment. So that could be requesting support to do a CRG related assessment, to inform decision making, or to review certain harm reduction programs from a community perspective in order to inform service delivery. So normally these assignments, TA assignments, include some form of data collection, for example, through key informant interviews or through focus group discussions, sometimes through online surveys. That really depends on what's most recommended in a particular context, to collect information with different groups that you want to learn more about, or understand a particular program or problem from their perspective. And then normally this data is analyzed and presented in form of a report, or in form of executive summary, or whatever format is most helpful for you to use in order to inform a particular process. The second bucket is around engagement in country dialogue processes. So that includes everything around consultations to inform national policies, guidelines, or plans. It also includes convening in order to inform Global Fund funding requests, or NSP midterm reviews or development. It includes engagement planning and joint strategizing, also for more targeted advocacy. So Normally that TA looks really more like providing support to conduct consultations, to develop priorities, sometimes budgeted priorities, and to provide guidance to communities to advocate for this inclusion of these priorities in different fora. The third bucket is support to design and implementation arrangements. So that includes different types of supports available. For example, it could include mapping of particular organizations that are already implementing or providing services to key populations, to inform implementation of global fund grants, but it could also include refining and validating tools that are used for community-led monitoring, or more broadly strengthening knowledge of people who use drugs, or maybe some particular groups, particularly women who use drugs, about global fund processes, or people from a particular region where you see they are not really engaged in global fund processes, but you really feel like they should be engaged. In terms of what is not important, and that's also important for me to mention because we get quite some questions around, can we support long-term capacity development of networks and organizations? And unfortunately, we can't support institutional strengthening. We can also not support CCM strengthening itself, and we can't support the actual writing of funding requests. So we can't mobilize an expert that writes the funding request for you, but we can support you during the writing process, for example. And I wanted to share with you some more concrete examples of TA requests that we have received in this cycle so far. The cycle started in January. And before this webinar, I actually went back to our TA list of the previous 3-year cycle to see how many TA requests actually came from people who use drugs or had a focus on harm reduction. And actually the number was very low. I think it was around 4 or 5 TA requests. So at least I was happy to see that the requests we have received so far in these 10 months of the year are actually more than we actually implemented in the last cycle. But with this webinar today, we want to increase this number further. So this slide shall really give you an idea of what type of support was requested so far. Ernesto will speak more to the first example, but for example, in Tanzania, we received a request to support an assessment on barriers to HIV services faced by under 18 youth living with HIV and their mothers who use drugs. From Zimbabwe, we received a request to actually do a situational analysis and needs assessment that will look at identifying patterns of drug use and barriers that people who use drugs face when accessing HIV and TB services. And the idea is really to use these results to inform programming for that community. So that are some examples of requests that we are currently reviewing or implementing. And maybe that gives you a bit more of an idea around what could be eligible or what you may be interested in requesting. I will not go into detail with the next 3 slides, but I also just wanted to highlight that here you can read through some more examples of TA that we provided in the past and that was eligible. So maybe it gives you some ideas around what you may want to request. And I really want to speak a bit more to our process around how does it actually work to request technical assistance. So we have this 5-stage process from application to implementation and then reporting and monitoring. And important in the application stage is that if you have an idea around what you want to address, which bottleneck you want to address, that you reach out to the CRG platform in your region. So there are in total 6 CRG platforms, and with us today are Mlewa and Iwan from the Anglophone African platform, but there are also platforms in Latin America, ICA region, Francophone Africa, MENA region, and Asia Pacific, and they can provide more guidance on the TA, the request form, etc. And we also require the platform to review the request before submission. Then we will do an internal eligibility check to review the criteria that you can read at the top of the slide. Very important here, is there a link to Global Fund processes? How can it strengthen engagement of people who use drugs in Global Fund processes? And once the TA request was approved, we will develop terms of reference together with you and mobilize experts from a TA provider, propose those to you, and if you agree, we would proceed with hiring the expert and proceed to implementation. And normally the TA lasts for around 3 months and up to 30 expert days. So that is what we mean with short-term TA. So we can't really support long-term projects for like 6 months, a year, but the support that can be mobilized through this short-term TA is really, really punctual. That's important to note. Coming to my last slide, I just wanted to highlight some of the information that you can find on the Global Fund website, on the community engagement page. That includes the technical assistance request form in 6 different languages, but also a guidance note that explains this whole process, also in all different languages. You can find an example of a good TA request, and you can also find on YouTube some videos around short-term TA and the CRG SI in general. So that's really a good point of information. And what is also key here is that you can find the contact information of the regional platforms, including their websites and the email address, how you can contact them. That's the email for CRG technical assistance if you want to submit your TA request at the end. So you can also, with questions, always approach that email address. So I'll stop here and handing over to you, Gaia.
Thank you so much, Annabelle. It was very useful. I think quite comprehensive and accessible to everyone. Please post your questions in the chat box if you have any to Annabelle. Otherwise, we'll wait to the Q&A for you to voice it. I'll now give the floor to Ernesto. Ernesto, are you here? Great. Hi, Ernesto. Please welcome and share your experience with us. It would be really helpful to hear how you made it. Yeah, please welcome. I know you don't have slides, so we're really looking forward to hear you.
Thanks, Anne. Thanks, everyone. Good morning, afternoon, evening, wherever you are in the world. So first of all, I would like to talk a little bit. Well, I don't have much time, so I'll try to go as fast and clear as I can. First of all, to try to understand that Latin American context, it's very different from the rest of the world when we're talking about people who use drugs. The main issue is we usually don't inject. People who inject drugs, it's not common. Injecting drugs is not a common practice in Latin America. And there's almost no, well, it's few opioids besides Colombia and Mexico and some big cities. It's not common to have people who use drugs, to inject drugs, sorry. You know? This also has created a whole, I don't know, emptiness. Now there's almost no harm reduction either in the region, and there hasn't been much empowerment of people who use drugs. You know, till 2019, people who use drugs in LANPUD had never been included as part of a Global Fund grant. You know? So first time we got included was in this multi-state or multi-region, multi-country grant, a regional grant with 10 networks of people living with HIV and other key populations, and it's taking place in 11 countries. You know, these 11 countries are the countries that are part of the Global Fund. In fact, the biggest countries in Latin America, Argentina, Brazil, Mexico, Chile are not included in this grant because the Global Fund has already left these countries. And these are the countries that we have the biggest membership in LANPUD. So when we got included in this grant, there were only, I think it was like 3 or 4 countries we had representatives from these 11 countries. So we had to start looking around and asking. So right now we have representatives from 18 countries. In fact, I see here we have Marisela from Honduras and Jerome from Peru. And this has also made us trying to understand and get more involved in the HIV response. Most of us from LANPUD come more from a drug policy reform advocacy area, or even more healthcare, in general, not as much in HIV. And we started realizing that there's almost no people who use drugs in any of the country coordination mechanisms and the HIV response in general. So we all also realized after a year being in this multi-country grant that the need to start a dialogue with governments, but mainly with other key population networks on see how we can include ourselves and include people who use drugs in this discussion and in these areas of political decision. So we sent a letter, we start doing these dialogues with the whole groups of networks now, but we realized it wasn't easy because it's a really new information for many people. There's a lot of stigma, there's a lot of criminalization. People don't really understand how to address it because we also have to understand we're focusing more on drug policy itself. As I said, we usually don't inject, and most of our interventions or advocacy areas focus more on stigma and criminalization and barriers to access to healthcare and medications. It's because criminalization to people who use drugs is very big. So we realized we had to go further. Now, at that point, we contact the LAC platform, Latin American and Caribbean platform. That is this platform that works with the Global Fund and help the organization and networks to ask for technical assistance. So then on, we realized that we had that opportunity and that support to write down and propose this technical assistance. Now we needed more information to show how people who use drugs are not part of CCMs or other coordination mechanisms, that we are not even considered a key population in any country in Latin America. So we had several meetings with the LAC platform, Anwar, Luna, and Rosa. Gonzalez helped us a lot. In fact, they helped us really, really much to write down. We had it clear what we wanted. Our objectives and our aims were clear, but writing down the process, it has some bureaucracy, and administrative processes that we didn't have the experience. So I want to recognize a lot the support we got from the LAC platform. And then on, it went really quick. Well, there was the C19 RM all stuff all together, so it was kind of delayed and late now, and we were in so many things all together. But in certain point, we got an email from Annabelle saying that they were really interested, that the proposal was really well written. So we had also a meeting with Annabelle, and we were really happy, we can say, because we understand how quick and how easy this process could be done. And also how quick after that we start doing the technical assistance. We had a meeting and we asked, we saw that the consultants was HRI. We had meetings with HRI also, with the staff of HRI. And we had negotiations because we also said, as I said in the beginning, our region and our context is very different from the rest of the world. So we really wanted to have specialists from Latin America helping to develop this technical assistance. So we had specialists from Puerto Rico and Argentina to help with us, but we also had support from our members from LANPUD, Veronica from Argentina and Jessica from Guatemala, to gather information. So what we did in this technical assistance was to have interviews with people who use drugs. We had interviews with key population networks from different countries. We had interviews with CCMs, definitely. We sent a questionnaire And we also had interviews with key actors, that has to deal with the HIV response in the region. All this came out a first draft of the document that was put out by HRI and our specialists now. And we had a workshop with our peers and members of LANPUD to validate this document, and it came out really well. And when it was I think 30 to 40 people who use drugs in this workshop. And after that, we had another workshop that was last Wednesday. We had this second workshop with the key population networks and other government officials and other key actors. There was 65 people. So we also realized there's a lot of interest in our region, and there's a lot of need to talk and dialogue and start thinking how we can go with this, because at the end, people understand the need to include people who use drugs in the HIV response, to include us as part of the whole international, national policies related to HIV and TB and malaria. But they didn't know how. Most people don't know how to go. People don't talk about drug policy. People don't talk about using drugs. Not even key population networks of people who also use drugs. In fact, we have said a lot. Our population is a really intersectional population. You have trans women who use drugs, you have gay men who use drugs, you have people living with HIV who use drugs, young people with HIV, gay using drugs. So when we start putting out this subject and this matter, we start looking and seeing people who are really interested. So right now, just to finish, because I think my time is done already, we're finalizing the report, where HRI is finalizing the report. Now we are going to take it together. It's been translated to English, Spanish, and we want to translate it also to Portuguese. Brazil is a huge country, the biggest country in the region that they speak Portuguese. And we want to put out other communication products as infographics or short videos, And we are also working together with LAC platform, to put out some more webinars, especially to CCMs and government officials. We think in different areas. There's 3 or 4 different time zones in Latin America, and also we have to also look how do we organize this, maybe in different areas. We're having a meeting tomorrow about that. But the important thing at the end is that we finally have a big document, an important document to put out and show the need to include, or to show the lack of participation of people who use drugs at the coordination mechanisms and the HIV response in the world, in Latin America, but also a lot of recommendations for us as key population network, as people who use drugs, but also for other key population networks to work for and push for our agenda, that is the whole agenda, but also for governments. So I'll stop there, and if you have any questions, I'll be glad to answer.
Thank you so much, Ernesto. This is very encouraging to hear, and we can hear that there is indeed, as Judy mentioned, a lot of intersectionality across the region, across the populations, and also what you mentioned, really fascinating how you collaborate across different countries and really on different scales. So well done. I hope this is also a great lesson to be shared and learned by everyone now. And I would like to invite Matt to continue. Hi, Matt. Thank you for sharing the presentation. Great, go ahead.
So thank you very much for inviting me to speak with you today. Thank you firstly to the Community Rights and Gender team for putting this priority on harm reduction in the last round, and inviting 3 harm reduction providers, COACT, Harm Reduction International and Mainline International, to join as pre-registered providers of short-term technical support. And I'm going to try to just introduce this model to you. In many ways, COACT is an attempt to make available the expertise on the technical expertise available within the drug using community, within the drug user rights networks, available on a private sector basis. It's essentially at this stage a marketing brand, and also a mechanism for undertaking project management and bringing together teams of peer consultants to deliver projects. Up until now, the challenge has been, we don't have core funding as an organisation, so we come into action when we have technical support contracts, and we're very grateful to MDM, Frontline AIDS, UNAIDS, WHO, and UNODC for all working with us to give us the chance to demonstrate and pilot the work that we are undertaking. In addition to working specifically in countries, which I will talk to you about, we have also been involved in gathering the technical learning from among the drug using community and sharing that in the form of technical briefings, particularly the employment guide, which we produced in collaboration with the Alliance for Public Health, and also the TB advocacy guide, which we produced in collaboration with the Stop TB program and INPUD. And also we've been involved in ongoing advocacy and technical development work around peer work as part of the global peer work consultation with MDM and INPUD. And this photograph comes from part of this sequence of work that's been developing since the Porto conference. So there we go. So let me just talk to you about the three different providers of short-term technical support. Ernesto has already very ably described the potential contribution of HRI, Harm Reduction International, particularly, though not exclusively, the expertise of HRI is focused on this role tracking the investment, or one should say the lack of investment in harm reduction globally, and looking at the impact that this investment or lack of investment has on global HIV and other health responses. So HRI is involved in advocating for increased investment in harm reduction and trying to encourage this redirection of resources away from ineffective law enforcement models towards harm reduction. And so what HRI can do within this technical support realm is to support local partners, including drug user organizations, to develop their own analysis of the funding of harm reduction, and to develop advocacy plans for sustainable funding. And that's critical in these countries where funding is moving away from international funding and towards hoping that governments will pick up that funding. So key technical resource here is shown in the slide and highlighting the important contribution that HRI can make. Mainline, many of you will know Mainline from its long-standing role as a harm reduction pioneer and provider in the Netherlands, but also through the work of Mainline International, their international development arm, and they've worked all around the world, doing particularly, really being a strong provider or an experienced provider of harm reduction and sharing that technical understanding and technical expertise about specific areas of harm reduction, from stimulants to chemsex to needle and syringe programs to naloxone, but also the management of that wider operational process. So let's move on to look at COACT. So COACT is an attempt to deliver technical support on a peer-to-peer basis. We deliver technical support on drug treatment and on harm reduction, but with a special interest in community mobilization. We can often end up doing wider work on drug treatment or harm reduction or other systems issues while we're in a country, but often what brings us into the country or brings our connection is this special focus on community mobilization. Through what this work, the work is undertaken in an international development setting. We're trying to do we're always delivering on a peer-to-peer basis. We have people with different language expertise, different technical expertise, different drugs expertise, women organizers, different people with different specialities. And we internally will try to match consultants based on their expertise to the local context. And we're also obviously experienced working through translators. We're often working in collaboration with local partners, driving forward an understanding of the science, ensuring a lens, a human rights lens, but also through our work, modeling and demonstrating the value of peer-led approaches. We're also bridge builders, which means we are both professionals and peers, so we understand the world from both sides. We understand people are trying to get it right, and we're trying to create a non-punitive environment where people can work to get community mobilization and meaningful participation right, and work through the challenges and be supported to be successful. And we're often helping people understand the expertise that exists within their own drug using communities. We have a range of different customers, but in this case, it's the CRG purchasing support on behalf of local providers through the CRG program. A number of our consultants are also registered with the UNAIDS Technical Support Fund. So you've heard about these three different areas around situation assessments and needs assessments, engaging in country dialogues, and supporting design and implementation. You can see how these different areas fit within the different technical support areas where we can contribute, whether around capacity building, around the delivery of community mobilization and peer-led harm reduction, using our expertise to gather information from our community through peer-led research, undertaking situation assessments to understand the environment, building our organization through network strengthening, delivering effective advocacy campaigns, and championing meaningful participation through this process. And then supported around all of that is a process of leadership coaching and development. To end with three examples of our work, I'm not going to go into any detail here, but we supported the Bridge Hope, what was originally the Afghan Drug User Group, to rebrand as Bridge Hope Health Organization and deliver a community consultation with key population partners. And that was key to establishing Bridge as a SSR within the Global Fund program. I won't go into more detail. In Myanmar, we helped MDM look at how they could use community mobilization, moving on from and building on from a more traditional harm reduction approach to have a dynamic partnership with the regional drug user network in Kachin. And then in Nigeria, helping the Duran network and the local community-led organizations have an active role in the implementation of the needle and syringe program pilot, and working with government stakeholders and local partners to design and deliver the implementation training. So that's our work. I'm sorry, it's a very fast overview of what can be delivered, but this is an unfolding area of work, and we look forward to exploring and expanding this work through the delivery of technical support contracts.
Thank you so much, Matt. Great, really fantastic. And thank you also for sharing the experience and the possibility of provision by HRI and mainline. So we welcome everyone to reach out to Matt and his colleagues in the respective organizations for this kind of support as well. And our final presentation today is from our colleagues from the regional platform, EANNASO, and Lewa and Yvonne will share their experience and also give us some insights into how can regional support be also useful for everyone. Please, Lewa, Yvonne.
Thank you very much. Sorry, I was trying to unmute and this error of technology. Okay, so my name is Onesmus Mlewa, and I work with Yvonne at EANNASO. And well, a lot has actually been spoken on the work that we actually do. So I'll just give a very quick brief to spur some conversation. I have actually 2 slides. These other slides have actually been spoken to already. We actually host the Anglophone Africa platform for the Global Fund Community Rights and Gender, and it covers actually around 25 African countries. So these are the areas that we support. Of course, our colleagues Francophone and MENA are covering most of the northern part of Africa. This is what Annabelle was actually talking on. I just want to speak on this central bit because this is one of the core areas that we always get some challenges and requests from. What actually CRG short-term technical support does not support. We actually keep on receiving a lot of CCM strengthening requests that either communities and listening to the discussion, we got it that communities of people who use drugs are less represented in CCMs, and that's the truth. So most of the time you will get requests that are aligned towards strengthening the representation of people who use drugs in CCMs, training them on CCM oversight and all that kind of stuff, which are not directly supported by the CRG short-term tier. But again, when we receive such tier, we always have this opportunity to link with other institutions that actually do this. We know that CCM Hub, which still again is a part of Global Fund, receive support from Global Fund, actually support the CCM evolution piece. So what we normally do, we link these requests to CCM Hub so that they can actually be able to get support on actually CCM engagement processes. Also, as Annabelle said, we normally receive quite a number of long-term capacity development issues from communities, especially things like developing our strategic plan, developing our human resources manuals, and all this kind of a thing, which are very key and important. But of course, we know short-term tier does not support this kind of interventions, but we always link with other tier providers. And I'm happy that UNAIDS has actually been spoken about here. They normally do provide some kind of institutional capacity development, technical assistance, and of course, sometimes also component 2 of the CRG does some long-term capacity development. So we normally do link these requests to these institutions so that then we really do not have requests that come in and then they are actually unattended. But of course, we know that the short-term tier does not actually focus on developing standalone tools or funding requests, as Annabelle said. So I really wanted to stress much more on this section because we keep on receiving a lot of requests aligned to this area, either CCM representation or institutional capacity development, and we always try our best to ensure that we link these to actually other tier providers or institutions that provide this kind of support. So I just wanted to quickly say what actually is our role as the platform when it comes into technical assistance. What we actually do is generating demand for short-term technical assistance, and we do this through multiple ways. It could be webinars like this. We normally organize targeted webinars sometimes for different constituencies. When we have a specific issue that we think is aligned to a particular constituency, it could be the constituency of drug users, it could be the constituency of MSMs, it could be the constituency of sex workers or general civil society and communities. We normally do targeted webinars, but of course we also do web posts, website posts. If you visited the websites of all the regional platforms, as has been explained, that we have 6 regional platforms. In most of the platforms, we have actually web posts on CRG technical assistance, which actually gives you a step-by-step approach on how you can actually request for technical assistance. But of course, we also use many other digital communication channels, MailChimp, WhatsApp, Facebook, Twitter. We all use this so that we can be able to create demand for technical assistance. And of course, where an opportunity allows, we do a lot of face-to-face meetings, which have proved to be very effective. When you actually have an opportunity to talk to people face-to-face and actually take through them through the TA request process, it really increases the number of people who actually access TAs. But of course, we don't just only create demand. The platforms are here to actually do a step-by-step process, guidance on how to complete the TA request form. Because most of the time, when it's not guided, most of the TA requests come as actual full proposals for funding to implement programs that extend beyond the 3 months that Annabelle actually talked about. So the platforms actually do a step-by-step guidance on how to complete the TA request form. We normally work with communities to actually go through the different sections of the TA form, showing them how relevant it will be so that it improves the quality of the TA and hence the success for its approval. But of course, we also go on to document case studies of the delivery of the TA, how important or significant this TA was to the community that was actually being supported. Did it increase or improve engagement of the communities into global fund processes? Basically, that's basically what we do. Actually, a good example, Matt, as you just said, that you did a very good exercise on defining the gaps, especially on harm reduction funding. Immediately after that study you did, we have actually been receiving quite a number of TA requests from harm reduction networks in the region. And one good case is in Uganda, where we actually successfully supported Uganda Harm Reduction Network to access community rights and gender technical assistance on developing harm reduction advocacy strategy to increase resources for harm reduction in Uganda. And this was one typical case where I think your collaboration of actually generating evidence, doing that study, showing that there are gaps in harm reduction funding, very clearly stipulated, actually supported to a greater extent on the quality of this TA that was actually approved by CRG. So this is basically part of the support that the platform actually does. But there are key lessons that we have actually learned throughout the process that I quickly want to highlight. Yes, targeted webinars are normally very, very good when we have such webinars like this where we target certain communities, because sometimes when you actually mix a lot of communities together, then their needs are so different, as you have clearly stated that the community of people who use drugs have quite very different needs looking at other KPs. In fact, in some other places, they're not even considered as KPs. So when you have targeted sessions with different communities, then it brings down on the specific areas and how they can actually be able to access TA. This becomes very, very useful, targeted webinars. But of course, the guided step-by-step writing of the TA is a very useful bit. So we always encourage communities that actually want to apply for TA to actually put the platforms on loop so that we can actually have a step-by-step process. Because sometimes we would have actually communities applying because the form is there and it's saying once you have done your application, send it directly to CRG because that's where it's supposed to go. And then you find that the TAs that go there are actually are either redirected back to the platforms because they are not meeting the right qualities. So the step-by-step guidance is very critical, and the platforms normally have staff who actually will always provide support on how to write and generate the type of quality TA so that it doesn't really get rejected or takes a lot of time for review when it goes to the CRG. But of course, use of internal consultants actually, and when I'm talking about internal consultants here, I'm talking about more specifically community experts. when we are talking about harm reduction, use of harm reduction experts, most of the time people who actually have are drug users themselves, has actually been very useful actually in skills retention, because these are people who actually understand the communities they're dealing with, and use of these experts or consultants has proven very, very key in skills retention, because at the end of the day, you really want to deliver a quality tier that will not just end up impacting on a particular outcome, but retain the skills so that they can continuously be able to do that as a good practice. And then another key lesson is actually the opportunity to link long-term and institutional capacity requests with other tier providers. I talked about this when I talked about what CRG doesn't support. So we find this as a good opportunity. We receive quite all sorts of tier requests. Some of them are long-term, some of them are for institutional development. But for us, we consider this as an opportunity to actually link with other tier providers who are actually able to fill in the gap and actually do this support. But what we are also seeing, and this is something probably for CRG us to try to consider, is actually the growing demand on institutional capacity support. This is happening quite a lot. And also the growing demand for long-term TA, which goes actually beyond the normal CRG short-term. But of course, the growing need for support in the actual writing process when it comes to fund requests and the processes for the Global Fund. You'll find that there are a lot of requests that are actually talking of, we really want to get our person, get a consultant who can actually sit at the writing table and actually put our priorities there. So these are some of the issues that actually we have learned on the way, and we always try to provide the best support possible. We know we can't be able to support the writing process, but we will say, yes, your constituent representatives are actually on the writing team. So make sure that you share your comments there so that they can share with the consultants so that your priorities actually do not fall off. So these are some of the key lessons that we have also learned on the tier processes. And I just wanted to make these very few submissions, and we'll be ready to respond to any questions, if any. Thank you very much. Merci.
Thank you so much, Lewa. This is a fantastic presentation, and we can see that, yeah, the role of regional platforms are crucial, and it helps us understand better the priorities and the technical requests from different key populations. So we really recognize your very important role. Thank you, everyone, all our speakers. We have now completed all the presentations, and I will now pass the floor to Judy to lead us on the Q&A. So now, please, everyone, if you have questions, raise your hand and we will now discuss. Thank you.
Thank you, everyone, and to all the fantastic speakers and panelists. So, yeah, I just want to check in with people if they have specific questions on any of the presentations, just because I know, well, it was an hour of information. I know it can be overwhelming, but if there's something specific that you want to ask to a specific panelist, please let me know. You can raise your hand, but also there's silence, so also feel free to unmute and ask directly. Okay, I might start off with, okay, Matt and Richard.
Yeah, I wanted to ask a question of Ernesto, if that was okay. So I'm interested in how long it took from the moment where you started thinking about technical support to the point where you had an allocated consultant. How long did that process take?
So thanks, Matt. We start thinking and planning with LAC platform. I think it was like March or April. It took a couple of months to send it. I think it was June. I'm not sure what happened in the Global Fund. Maybe Annabelle would know a little bit, but I think it was the C19 RM, and we understood it. We were all crazy going around with that. But after that, I think it was like July. We started in August, and we're almost finished. So it was really, really quick from my experience in anything in my life.
Great, thanks, Ernesto. And Richard, I think oh, yeah, there you go.
Thank you for the floor. First of all, I would like to.
One of my people is already so yeah. I get.
Sorry, go on, Richard.
Thank you, and first of all, I would like to thank all the speakers. Wonderful presentation. My question is can a network, in-country network, ask for technical assistance without passing through CCM directly? I'm asking that question because we used to ask technical assistance time when I was coordinating BAPUD, and they say the technical assistance must be led by the CCM. Is it always the rule? Thank you.
Thanks, Richard. Annabelle, I may call on you to answer that.
Yeah, sure. Thanks a lot, Richard, for the question. So what you will see when you have a look at the request form is that at the end, we have some questions around who you have engaged with during development of the TA request. So we asked, did you, for example, coordinate with the country team? Because in some cases, organizations request TA after they had a discussion already with someone at the Global Fund. Then we asked, did you engage with the CCM? So most requests have been coordinated at least with the CCM KP representative, in some cases with the Secretariat, but that is not a requirement for us to decline the request once we receive the request, because we are also very aware about sensitivities at country level, that sometimes there are certain reasons why you have not yet coordinated it before submitting. So it does not need to come from the CCM. That's not at all our requirement. Our requirement is rather, it shouldn't be submitted by the CCM, but it should be submitted by the communities themselves, so by the network you were mentioning. And here we can see the section. So we have a question, have you liaised with the CCM regarding the TA? And if so, who have you contacted? Have you liaised with the Global Fund? Have you requested support from the regional platform? That's a requirement. We require the regional platform to review the request prior to submission to us to make sure it's a pre-review and it aligns with our eligibility more or less. And then the 4.4 is around, have you applied to other TA providers with a similar request, just for us to know if you're talking to different TA providers at the same time. And after this question, maybe I can also quickly add one point, Judy, around timing, because I realized that I forgot mentioning it. So normally we say that from request submission to implementation, it can take up to 3 months for us to mobilize the expert, to coordinate internally the request, take an eligibility decision, etc. So that's why we advise that you submit the request as early as possible. Sometimes I receive requests on the 10th of October with the TA to start on the 15th of October. That's just not feasible for us, unfortunately, because we are working on TA, maybe 40 TA assignments in parallel. We are also making sure that it's not duplicative, maybe with any other TA providers, partners. So if you're planning to submit a TA request, it would be really helpful if now you already start thinking around what are the processes coming up in your country beginning of next year. Will there be any review of key policies, NSP review, reprogramming of Global Fund grants? Is there any key opportunity where you may want to request and mobilize technical assistance? And it would be worth already working on the request, submitting it, so that we make sure we have enough time to provide you with the right expertise and to make sure that we really can influence the process that you want to influence.
Thanks, Annabelle. I'll just check if that was very clear. I'll just check if there are any other hands. I have a couple of questions, but I'll just call on Sadie, and please feel free to put your questions in the chat as well. There's just a question, what about engagement and information? I'm not sure, Annabelle, if you understand specifically about that question, or Sadie, could you just explain a bit more? Okay, so I just had a couple of questions. One, I was just wondering, can people propose the short-term TA provider that they would prefer, but knowing that, you know, ultimately people a lot get matched up, but is it worth, you know, mentioning the preferred provider? And secondly, yes, you mentioned in a short-term TA request, you know, there are some things that may make you ineligible, such as timing, but also, you know, it looks better to have coordinated with others. Do people get feedback on why a TA request was not successful, like specific feedback, so they can, you know, address it for next time?
Yeah, great question. So in terms of the TA provider, as you know, we have like a broad range, long list of TA providers. And when we get a request, we normally look at what is the technical expertise required, what is the country focus of the request, what is the language required. And then we reach out to between 1 and 3 TA providers for individual assignments. And then once we have received the proposed expert CVs based on the criteria I just mentioned, but also taking into consideration, are TA providers proposing an international expert who would have to fly, or are they proposing experts that are actually from the region of assignment? Plus, also we look at the different proposed costs of the TA assignment. We take a decision around who we propose to the TA requester. So we would never proceed with an expert or with a TA provider that was not approved by the requesting organization. We always share the CVs with you. And yes, you can propose a TA provider, and we will consider that in the selection process. It may not necessarily always be that we also consider this TA provider most suitable for a certain assignment, but then we are discussing that. So yes, please feel free to mention that under other comments. And then, Judy, you have to remind me, what was the second question?
Oh, just if there's feedback on like why a TA request has been rejected, like specifically. So
yeah, exactly. So in the past, in the previous cycle, we actually received quite some feedback from requesters that the level of feedback we provided was sometimes not enough in order for them to review the request or to look for other opportunities. So we are really trying to improve on 2 points. The first one is, if we are not able to support a request because it doesn't fit within what we can support, we're trying to redirect people, for example, to bilateral TA providers like GIZ or Expertise France. We try to redirect them to technical partners, sometimes UNAIDS, etc. So we're trying to make these links. And we are also, when a request is declined, we are also mentioning the reasons for why it was not considered eligible during the internal review.
thank you. So I see 2 hands. I'll just go to Sadie first, just to clarify a question in the chat. And Sadie, you might just go to Matt first whilst you're unmuting. Matt?
Right. Yeah.
Yeah.
Okay, so in terms of the relationships between the technical support providers, I think one of the things I'm really pleased about is that HRI, COACT, INPUD, Mainline International are all working together very closely and collaboratively as we develop this work together. So we're discussing the background development of this work, recognizing that we have some areas of overlapping expertise and other areas where there's clear differences between what we're bringing into play. I think if you look at Nigeria, for example, COACT was involved through Frontline Aids and the CRG delivering technical support in 1 year to help the implementation of the needle and syringe pilot program, and then working with Duran as part of that process. And then as part of a longer term commitment to technical support, INPUD is now working in Nigeria. And I think that ability to talk to each other, to be sharing technical resources, recognizing that we are, particularly INPUD and COACT, we are bringing many of the same technical resources into play and helping people use technical toolkits from the drug using community. So I think it's a very non-competitive environment. So if you're talking to one person and you're going into the wrong area, people will steer you in the right direction. And I think we're in a very, very supportive working environment, which I'm very pleased about.
So Saidi, okay, if you want to explain more in the chat. Whilst just I'm waiting for that, Ernesto had a question, and then I think, yeah, we can move to the clinic if you have enough time. Ernesto is just asking, has there been a TA request form for networks or organizations from different regions, such as a South to South request?
No, I'm not aware of any South to South requests. So in terms of regional requests, I think the request from LANPUD was the first one, actually spanning different regions. Normally they are more country-specific requests, but it also comes from the nature that the request needs to be linked to global funder related processes, right? So it can either be linked to a global fund grant in a particular country, or it can be linked to a multi-country grant, but not very often, like there is no cross-regional implementation. So that's why we then normally rather advise to have a region-specific or a country-specific request. But the coming back to the point around then what do we do with the learnings from the TA and the deliverables, etc. And Matt also pointed out to the use of the results of the TA. And I think there is really an opportunity because the TA deliverables, I mean, they are used by the requesting organization. The organization owns it. We are not putting our logo on there. It's really for the requester to design it in the way they need it. In terms of if it's a report, then it can be a report. If it's just a PowerPoint presentation, it's a PowerPoint presentation. We have some flexibility around what format is most helpful for you. And then we can use, for example, the regional platforms. So in this case, the Via Libre, the LAC platform, to actually further disseminate outputs of the TA. And I think it's also great that we're having the webinar with you, Judy, and I think INPUD, we can also share results of the TA in this forum and really make sure that it will not be siloed TA implementation, but that the learnings are actually shared beyond particular countries, regions, etc.
Thanks, Annabelle. I'll just pass over to Gaia for the rest. Sorry, the questions took up a bit, but they were all very important questions.
Thanks so much, Judy, and thanks everyone for the discussion. So we just wanted to have also an opportunity to sort of do a clinical trial. So just to see whether anyone among you has something in mind for the TA request, and the most pressing issue for you, for your community, that you would like to apply for. And please raise your hand or voice it in the chat, whether you would like to share it with everyone, and also receive feedback and advice from our speakers.
I think Bishnu wanted to speak before.
Yeah, I wanted to speak
Welcome,
a little
Bishnu.
bit about.
Absolutely.
Yeah, thank you, Judy, Gaia, and everyone for this meeting, and especially for the TA support for our country. It was excellent, and especially thank for input, while CR 19 RM proposal community engagement process that we received, and we collaboratively all civil society, not only the PWID community, with that TA, we bring together all key population, including PLHIV together, and we started to engage in a process. Finally, we consulted, joined, prioritize issues, we submitted to the CCM, and we achieved collaboratively come together, and we could submit, even the faster during the fast track proposal, we started raise our issue, community need, and full funding application. We were fully engaged, and that sort of support, we started communicating with the CCM, civil society representative, because they have a frequent meeting to regarding the proposal and grant making process. So it was excellent experience that we had in our country. So, and another issue today, the presentation TA request that from CRG, from Global Fund, and excited to see that, TA request, especially in Nepal, in a need assessment. We thought since long time, we thought a need.
I think we lost you, Vishnu. Hello?
Hello?
Yeah, you're back.
Yeah, the women regulators are, with the help of input, especially from the mainline support through input, we strengthen female regulators network in the country, and finally they able to start response the community, including community-based harm reduction in the partner. At the same time, they need institutional capacity building. Same time, because they started receiving. They become, within a year now they become SR for the Global Fund, but at the same time they have challenges. The institutional capacity. This is the key area that we may look for support in the future. So the CRG support was excellent, because that given a good platform, to bring together national network together and discuss our national issue in response to HIV/AIDS program, supporting each other. And that was a great experience. We come on a agreement that we bring loose network among national network. So we will start communicate. We can start dialogue, the national issue in response to Global Fund program, especially in the accountability, transparency, and community engagement. The community engagement is a little bit, from our side, we followed all the guidelines. In the grant making process and the grant negotiation process, that where we feel it is not a meaningful engagement from civil society, because it all taken care of by consultant, CCM Secretariat, and the government. And later on, we started to feel that sometimes, the PR and government, they join together and try to address our issue is a smaller proportion of total funding. That was a bad experience. So that I'm being as a community leader since long time. Then the BD experience that given me to make big decision. Okay, I'm not going to take single penny from Global Fund unless and until go on PR or CCM do not revise and review their program towards the comprehensive response to the civil society.
Vishnu, I'm sorry, we're running out of time. Could you make it a little bit short and just clarify?
Yeah, thank you. That's it.
Thank you so much.
Yeah, thank you, Gaia. Thank you.
Thank you so much, Vishnu. Annabelle, anyone else among our speakers, could you respond to Vishnu's request?
Thanks a lot, Vishnu, for outlining the situation. I think the connectivity cut sometimes, so
yeah.
Let me try to come in on 2 points mainly. So what I heard around challenges, around institutional capacity of implementers that you are mentioning. So I think that's one of the areas that we can unfortunately not support, and I think that's where we see there is quite a demand, but that's nothing we feel we can address with short-term technical assistance that is available. However, the other challenge you mentioned with regards to community participation in actual grant-making processes, that's also something we see in a lot of different contexts, that the space for engagement gets particularly narrow around the grant-making process. So that's definitely a point in time that we can support. For example, by bringing communities together to look at different drafts of documents during the grant-making process and re-strategizing around they want to push for inclusion and continued inclusion in the remaining of their priorities in the final grant. It can also be in some cases what we have supported if during the funding request phase, if there was a particular budget foreseen, for example, I'm just thinking about in another case, we had a grant, there was a particular budget foreseen for services for transgender people. So actually what we then supported is consultations with the transgender community to more clearly define the services and the interventions they wanted to be covered with that blocked amount. So that is also possible to do that. Just
yeah, regarding the need assessment, I raise maybe due to internet, need assessment is our top priority because it's not been done since many years, and without need assessment, we are implementing program. It's a key area intervention, maybe TA support we need.
So that's possible, for example, to request support for a needs assessment. If you feel like certain services, particularly now with the pandemic, we saw it a lot, that certain services did not reach the community they were supposed to reach. And it was difficult to analyze that and bring the data and information together. So what we can support is a rapid assessment with service users to hear their perspective around what barriers exist for them accessing harm reduction services, and developing recommendation on what can be improved so that you can use it for advocacy purpose.
Yeah, thank you for that.
I can see that Matt raised your hand. Please go ahead, Matt.
Yeah, and also sometimes we can do things technically that can be funded through the program, and there can be side benefits for the drug user group. So for example, one of the lessons we drew from the community consultation in Afghanistan was that we could be funded to do the community consultation, but then once the community consultation was finished, we could invite the people who took part in the focus groups to join the drug user group, to help join the drug user group, to build it, to develop the drug user group beyond the specific remit of the community consultation. So I think sometimes you can be smart about how you get those additional benefits for network strengthening beyond the specific piece of technical support.
Great. Thank you all so much. I think it was a great discussion. I'll hand over to Judy. If we have any further questions, let us know. But since we almost reached the end of the meeting, perhaps we can wrap it up. Judy?
Thank you. I'll just be very brief because I know we're over time, and really just, in summary, just really wanted to thank everybody for joining and thank for the fantastic presentations as well. I know it was a lot of information. There are a couple of the points that, we couldn't answer fully, but as Gaia said before, please do email us, follow up. I see that EANNASO has also shared their contact details as well. So yes, this is just the beginning of the process. We wanted to share more information, and of course, can advise in the steps as well for follow-up. So thank you again. I know it's difficult to get everyone together for 1.5 hours these days, so very much appreciate it.
Great, thank you all so much. Now we will just take a quick photo of everyone. So if all of you are comfortable, please put your videos on. I think it was a great discussion. And we will send and share all the presentations and the contact details of the speakers so that you can always reach out and ask more questions directly. Thank you. Jake?
All right, give me 1 sec. Someone get your cameras on if you're comfortable. Let me get my set up. Okay, everyone ready? All right, 3, 2, 1, smile. All right, got it. Thanks, everyone.
Thank you. Thank you so much, and have a great rest of the day. Bye-bye.
Thank you. Thank you.
Thanks,
bye-bye.
Gaia.
Thank you.
Bye-bye.
Yeah.
Now it's getting out now, out of question. Bye-bye. Mtihani. All right, bye.